The Senior Reset podcast delivers education and resources to help seniors and their families set themselves up for success. Each week, we dive deep with medical professionals and industry leaders to bring you answers to the questions that matter most. From the latest medical advice to financial strategies to staying ahead of scams, we'll build the toolkit you need to thrive. Here's your host, Joel Stewart.
All right, everybody. Welcome to the Senior Reset podcast and events. Here is where we are trying to bring resources, education, solutions, entertainment, and training to the senior community and their families. There's a lot that needs to be learned as we get older, and not a lot of places where you can find that information in an easy to get format, and we're going to remedy that. So to that end, we are going to have some great guests on today. We have Crystal Lane from Integrative Healthcare Systems, and she has got a great career behind her, 33 years as a nurse. She is passionate about reaching the seeming unreached in today's society by providing them with medical education and awareness, communication with professionals, and quality care coordination under the provider title, Integrated Healthcare Coordination and the Medicaid Waiver. Crystal and her company are currently serving the entire state of Indiana, and they are expanding to 41 different states and 2 Virgin Island territories. So almost anywhere in the United States where you are, if you are dealing with Medicaid issues, Crystal may be able to help. But today we are going to dig into Medicare and Medicaid. What are they? Who qualifies for these, and how can these systems help you? Our title for today's podcast is Demystifying Medicaid, and we are going to attempt to do just that, and not in a manner that is horribly boring and make you want to rip your ears out. So, all right. So without further ado, Crystal, welcome.
Thank you, Joel.
Can you tell us a little bit about, just give us a little bit of your background. I just gave like a little 2-second summary, but tell us how you got to where you are today and you know, the need that you're trying to fill with integrative healthcare solutions or systems. Sorry.
Sure. So FSSA had contacted me in order to kind of head up.
And what's FFSA? Because a lot of the people listening aren't even going to know.
Social Service Administration. So they, sorry, I just
okay.
assume everyone knows, I guess. So they oversee Medicaid rules and regs. So they had contacted wanting for me to head up a pilot program. So that's kind of how I got started in this. But as a home health and hospice nurse, it's really that nurse's responsibility to ensure that the gap has been closed in healthcare. And honestly, it wasn't being. So this was a very interesting venture that had expanded exponentially throughout the time that the pilot was going on. So it was.
Do you mind explaining a little bit what that gap is that you're referring to?
Sure. Those gap in services is when a patient is discharged from the hospital to home with absolutely no help whatsoever. So there may not be attendant care in the home. Nursing may not be in place. They're a fall risk. They shouldn't be alone. There isn't a call button for them just to be able to summon a nurse, essentially. Their meds may not be accurate when they get home. So all of those factors are involved in that patient's health care. And they were being sent home with nothing. And so it was up to the patient to navigate their own health care. And most of those patients don't have the ability to do that. Unfortunately, there are families that just don't want to be involved. And so the patient is left with nothing. And they're not getting their medications or the right medications, because once they're discharged to home, they may have all new medication. And so that's not being fulfilled appropriately. There aren't any services in place. That patient may not be able to cook their own meal after a good stint in the hospital. And so it was just really disheartening to see the need there, but no one is doing anything about it. And this actually does. In healthcare coordination, it is our responsibility to assist with closing that gap. So our coordinators assist those patients with everything that I just said. We set up all services, we follow those services. We do face-to-face visits with those patients or clients on this side of the fence. And it's just really important that we're there during those follow-up and any subsequent physician visit that patient or client has. And we do all of that to ensure that they're getting continuity of care, and that all of those physicians or anyone in the care team is knowledgeable as to what is happening with that patient or client. And so that's kind of where we close the gap within that system, that break that shouldn't be there.
Wow. All right. Well, so what is it that makes a position like that necessary? I mean, I imagine that people are getting referrals out to Medicaid or Medicare when they leave the hospital, but if that coordination just isn't happening, what are some of the factors that cause that in the system?
Honestly, in the hospital setting, the nurses are very overwhelmed sometimes. And they may have a nurse to patient ratio. You have one nurse and who knows how many patients you have. It doesn't really matter, I guess, so much as how many patients, but the complexity of the case, which makes it more difficult. But at the same time, that nurse is still coattailing the physician. And if the physician doesn't want to write an order for something, they're not going to. And a lot of that stuff really gets overlooked, but also the patient themselves may not be communicating what's really going on at home and those underlying factors, which can also cause a break in their care or that gap.
Yeah.
So
Well, is there like it gets sent to like a case manager, right? With Medicaid or
absolutely
Medicare and they're like there's somebody that's supposed to be on the ball with that stuff,
not
but
always.
not
Most of
always.
the time, not. No,
I mean, government
no.
healthcare doesn't always have somebody on the ball. That's
Right. I know that's a big shock.
the problem is just the sheer number of people though, right? It's a case manager could have who knows how many people.
Well, that's true. And, the case managers I know with divisions of aging, they are very overwhelmed. And that's why we're here on the integrated healthcare coordination side, because those care managers are very overwhelmed. They may have 100 to 150 clients on their caseload. How effective can it be, even if that care manager is reaching out to every client once every 3 months? It's not effective. They can't manage their entire aspect of their life as they should with a lot of these clients, because they may not have the ability to do so. So that's where we come in to really grab a hold of the healthcare coordination side, and our coordinators just kind of run with anything and everything that they need in order to make sure that we are closing that gap.
Yeah, well, I guess with that, I want to introduce someone else we have here with us, Austin. Austin works with Crystal at Integrative Healthcare Systems, and he used to be one of these case managers that was just completely overloaded.
Yeah.
So,
So if you think about care managers, for example, a lot of care managers on average have 100 to 150 to 200. I mean, quite frankly, care managers are just as busy, if not busier, than a one-legged man in a butt kicking contest. That's how it all goes. Ultimately, you have things that are falling through the cracks, and you're trying to keep up with everything. But on top of it, if you as a care manager burn out, then how are you going to help your clients? I mean, ultimately, if we think about it, you have waiver. Waiver requires care management. Shouldn't those care managers have some sort of support? Where if you think about integrated healthcare services, that ultimately bridging the gap could be just as simple as making those weekly contacts when the care managers can only do maybe about 70 a month. If you think about
Wow.
70 versus 150, that's a little bit of a lopsided number right there.
That's crazy. Well, let's take that. You mentioned the waiver program, and this brings up the main topic of today's program is demystifying Medicaid and Medicare. And under Medicaid, you actually have this other, and maybe you can even correct my knowledge on this, but it almost seems like you've got Medicaid, and then you have like this other little rogue, child of Medicaid called the Medicaid Waiver, and they go through and it's like almost a whole different thing with different people that qualify and different services that are available. So if you don't mind, just can you give an overview of just a brief high level overview of what Medicare is, who qualifies for it, what Medicaid is, who qualifies for that, and then what this Medicaid waiver is, and maybe how that came about.
Okay, feel free to correct me if I'm wrong, Crystal, but Medicare, for example, is a insurance for people who are advanced in age and would typically cover their medications, their hospital doctor visits, basically it takes our average insurance and makes it easy for the elderly to use. Medicaid, on the other hand, is for a group of that's called the aged and disabled. They are able to get these types of services and get them paid for, such as the attendant care, the home delivered meals, the personal emergency response systems,
Healthcare coordination.
healthcare coordination. And it's almost like Medicare, but with added services and benefits.
So if someone's over 65 retiring, those are the people that are probably going to be tapping into Medicare services, but Medicaid could be any age. It really depends on your physical condition. Kind of how does that?
So
their income plays a factor too, right?
Yeah, it does.
Medicaid.
It does. So with Medicaid waiver, those clients actually qualify for what we call extra services, and they qualify for those based upon their comorbidities. So if they're a fall risk, plus they've had a stroke. I'm just throwing those out as examples. So they've had a stroke, and as a result of the stroke, they're now a fall risk. So that would qualify someone for Medicaid waiver as long as they were within the income guideline. So with that being said, there is a process to being qualified, having their assessment completed by a division of aging. So anywhere in the state, there are 17, I believe, divisions of aging within Indiana. So depending on the location that they're in, so they would be assigned, they would call that division of aging and essentially get set up with an appointment for an assessment, their initial assessment, and then they have a secondary assessment on top of that. Once they're approved for waiver, then services can be put on that client service plan, whether it is home delivered meals, attendant care, healthcare coordination, HME, DME, incontinence supplies. I mean, there are so many things that really waiver can cover. Medicare. Go ahead.
Keep going. No, keep going. Keep on the Medicare side.
Medicare, on the other hand, that is a very complex beast over there. There are actual Medicare reps that will assist people in order to navigate the Medicare system. Medicare isn't just cut and dry. Medicaid is fairly cut and dry compared to Medicare. Medicare has so many different plans. There's, Part A, Part B, Part C, D, et cetera, et cetera. And they don't always cover everything 100%. Typically, Medicare is an 80-20 plan, which then the client or patient has to have a supplement in order to pick up that 20%. That is a very complex beast. They also are very limited in, believe it or not, services. They don't offer the home delivered meals. They don't offer healthcare coordination, or they might have a case manager within, depending on who their Medicare plan is with, because it isn't just Medicare. There is other alternative plans as well, like Anthem and United Healthcare. So it just depends on what plan they actually have, what that plan will cover. Medicaid waiver, Medicaid and waiver, I should say, combined, they cover everything 100%. So that is the difference in Medicare and Medicaid with waiver additionally.
Okay.
Did I just confuse it?
No, well, the whole point of this is to demystify Medicare and Medicaid, and but you have to start flushing things out to really start to kind of unravel them. So, like, even right now, as we've tried to spell these out, it's like a big bowl of spaghetti. Like everything's just going everywhere. So Medicare, and this is my understanding of it, is Medicare is a federal program, but Medicaid is a state program. And also, from my understanding, from my own interactions, is Medicaid requires you to list any other insurance first. So if someone is over 65, perhaps they have Medicare and Medicaid. How do they approach this with a provider? Do they approach it to have it covered by Medicare, and does Medicaid supplement it? Should they go and just try to get it straight covered by Medicaid? How would someone approach a provider that would need a service?
Well, I believe Medicare trumps Medicaid in most cases, if it's a covered item, right, Crystal?
Correct.
Oh, you know what? I just realized I have not introduced Nicole Farmer to our talk today. Nicole is my co-host.
Okay.
She's a registered nurse in Indiana. She's part of Signal Health Group, which is making this event and podcast possible. So welcome to our event, Nicole. You'll be seeing a whole lot more of her if you follow us on our weekly podcasts and events.
Thanks, Joel.
Yes, a lot of knowledge in this room. Let's see if together, with our brains combined, we can solve what is Medicare and Medicaid. Okay, so Medicaid, it seems like if you can qualify for it, is going to work much better for you than Medicare, and it'll cover a lot of the same services. Is that correct? Or is there things that Medicare covers that Medicaid doesn't touch?
Well, I think honestly, it's just the opposite. I think Medicaid covers more, and once you are approved for Medicaid, it's very easy for you to, if you qualify for the waiver program, for those extra services to be added to your case, essentially. But Medicaid actually covers more than Medicare. Medicare is not limited to older folks either. Medicare, if someone has been on disability for 2+ years, then they automatically are, I think, placed on Medicare. So is that right, Nicole? Do you know?
Yeah, they can apply for it, and if they qualify for Medicare after they've been on disability, yes.
Okay, yeah. Whereas Medicaid is more of that income based. So if you are within that income limit, then you qualify for Medicaid. Now, to be qualified for the waiver program, which are those extra services, those rely on your inabilities to perform daily tasks, essentially. So if you're having problems with your activities of daily living, you're having issues with bathing or doing your laundry or needing transportation, healthcare coordination. I always have to throw that in there, of course. If you need home delivered meals because you really can't cook for yourself, those are all covered 100% under Medicaid waiver. So Medicaid itself is income driven. Waiver is if you're already on Medicaid, which you have to be in order to be on waiver. The waiver is actually not income driven per se, because you're already on Medicaid at that point. So that's already something that the hurdle's already been jumped with the income. Waiver is if you need those extra services, if you're having issues for performing certain tasks at home, then that's where waiver comes into play. That is all covered 100% under Medicaid.
Okay.
And I come from a home care world. So like with Medicare, that's a skilled thing where they will cover 100%. Now, Crystal's right, 80-20 typically as far as outpatient services go, hospital doctors, but they will cover skilled nursing, therapy, and those kind of things in the home under Medicare, which is federal. You know, it's not just an age requirement. They're not, the income guidelines aren't there. And then we go down to Medicaid, which is income driven. They have to qualify for it. Those rates vary from state to state, what you can make and what you can do. Those cover a little more of the personal care services. So the Medicare is going to come in and be in and out a couple times a week, maybe for nursing or therapy. Then we get into Medicaid, they're going to be in there a few times a week for bathing and for some hands-on care. But for someone that still can't clean their house, can't, you know, prep their meals, forgets to take their medication, needs reminders, that's when we work with people like Crystal and Austin on the waiver program. So these people are already Medicaid qualified. And now we have to see if their limited ADLs, their inability to do their things, will help them qualify for the waiver services. If I'm just understanding all of it correctly on your end.
Correct. And there are different types of waiver as well. So we are under 3 separate waiver programs. So ours are aged and disabled. So that can be 0 to 100 and whatever. The age, there is no limit on age at that point. Then there is TBI waiver, which is traumatic brain injury. And we do have clients under the TBI waiver. And then we have an MFP waiver, which is money follows the person. And that waiver is specific to folks who are being discharged from a nursing facility to home. That waiver follows that client for 1 year. So that's kind of the differentiate. Those are the waivers kind of broken down a little bit.
Yeah.
I'm not going to go into too much detail because it can be
going into clear as mud
tangled web.
territory.
So
the money follows the person is basically someone that's not quite set up for a full waiver yet, but needs services when they go home. Correct? Right? Kind of.
Well, no, it's an entire, it's just a whole separate waiver on its own, specific for nursing facility discharges to home.
Okay.
If I can
So they
dovetail-
can, after that MFP waiver, can qualify if they are still in need of waiver services, then they can qualify for A&D waiver.
If I can dovetail off of that, usually when the money follows a person, individual is going from nursing facility to home, they possess something called community transition funds, which ultimately will assist them into transitioning back home. Usually it's around $1,500 that they make a request form for specific items that they need. Those items are then ordered and put to their home.
Good to know.
All right. I want to go back a little bit. We'll backtrack a little, probably backtrack a lot over the course of this to try to flush some things out. So you said that so Medicare, it can apply if you are disabled for an X number of years. And I believe Medicaid also has some kind of special program for disabilities. How does this in practice work for somebody that has a disabled dependent? So this could be Someone with a disabled dependent adult, could be someone who's older, younger, that they're dependent, or it could even be a child. Does somebody that is a disabled dependent, either through injury or even by birth, like my own son has Down syndrome, so he's probably going to be with us forever, no empty nest, yay. But so like, how would that work as far as qualifying for things like Medicare or Medicaid? Does it follow them because of their disability, regardless of income? I know that's getting really kind of in the weeds. I'm just wondering if there's any insight on that.
So there is a waiver program specific to exactly what you're talking about, Joel. And, for example, your son has Downs. He could potentially qualify for the CIH waiver. And that is really, that's kind of something that we don't handle within what we currently do, just because they consider that to be double dipping in waiver funds. So they don't allow healthcare coordination for the CIH waiver. CIH waiver is more like a transitional housing situation, where there are group homes that the client lives in, and they receive their medications there. They do have on-site staff that kind of oversees, and typically there may be 8 to 10 folks to a home. So it's a very small community within one home. There's also that outside program where they will go from the home into a work environment. That's all controlled. So I'm not really going to speak too much upon that, because that's not something that I deal with on a day-to-day. But I do know that piece of it. Other than that, I'm really kind of not at liberty to discuss it.
Gotcha.
But the A&D waiver, if there are limitations, it doesn't matter if it's something that occurred at birth, if it's genetic, if it's, something, a tragic accident happened, whatever that may be, they could potentially qualify for waiver as long as they fall within the income guidelines of Medicaid.
Okay. Yeah, so I think I want to try to do a little bit of a pivot here. We've talked a little bit about Medicaid and Medicare and the Medicaid waiver, and it's a lot of really kind of intense, deep topics. I want to focus down on Medicaid a little bit, on the Medicaid versus Medicaid waiver. Can you just talk for a little bit and help delineate what those two things are? Like, why are they different? Why does somebody not be approved for something through Medicaid, but then be approved through a waiver? What are these two programs? They seem almost completely separate, but at the same time, they're like in the same breath as far as them being related. So maybe we can try to delve into that a little bit, because if someone's like, oh, you might be able to get that through Medicaid waiver, it's like, what does that even mean? So we have Medicaid, which I guess is like the daddy or the parent program, and then you've got the Medicaid waiver, which is kind of an offshoot. Do you mind just going a little bit of detail on these and helping delineate Medicaid and the Medicaid waiver and their differences and their similarities?
Crystal's not gonna be able to unmute herself.
Oh,
I got it.
Okay, good.
Thanks. I'm sorry, Joel. Can you rewind for just a second and
yeah, sure.
ask that? Sure. Thank you.
Yeah, I was just wondering, separating out the Medicaid and Medicaid waiver, what are these two things? Like, they seem related, but they also seem like really night and day different. Could you just talk a little bit about like Medicaid? And it seems that Medicaid is there to help people who are disabled, who are low income. But then this whole Medicaid waiver thing is kind of spun off of it and seems to have different requirements to it, and it services different things. Can you just go into the differences between Medicaid and the Medicaid waiver?
Sure. So Medicaid itself is a health plan, essentially. So, that covers anything from medication, doctor's visits, etc. It doesn't cover everything that is covered under waiver. So that is where things differ. So waiver is strictly, you can just kind of look at, Medicaid itself, you can look at as just like a regular health plan. You go to your primary care, it pays for it. You go to the pharmacy, get your medication, Medicaid pays for that. Waiver is something that, yes, is a spinoff, but it's not an insurance per se. It is a kind of a supplement to Medicaid itself. And it covers those extra special services that Medicaid itself doesn't even offer. So waiver covers those HME, DME, which is the home medical equipment, durable medical equipment, attendant care services, homemaker services, care management, IHCC services, transportation. So it covers all of these things. The reason why it does is because Medicaid saw that there was a tremendous need for extra services that were not being offered by Medicaid. So waiver, you have to qualify for. Just because you have Medicaid doesn't mean that you're going to qualify for waiver. So you need to be under that category of aged and disabled, or aged and or disabled, I should say. You don't have to be both, or traumatic brain injury, or money follows the person. So the aged and disabled waiver is the one that we see the most. And again, we service clients from birth throughout life. Typically, when someone is on the waiver for those extra services, they continue to be on the waiver for the duration. And that is because their need was there to qualify them for those extra services. So again, it isn't just a money-driven waiver program. It is, you have to medically qualify. Now, we don't have to see, or we do on our end need to see diagnosis, but the care managers who actually initially qualify that client for waiver doesn't need to see documentation from a physician. They just need to know what is going on with you in the home, what kind of needs are not being met, and see if we can assist them in making sure that their needs are met. And so that is the biggest difference, I guess, in Medicaid and waiver.
So if I can just add to that real quick, because we do, and a lot of people don't know that this waiver exists. A lot of people I contact daily that need help with just their homemaking or their errands, they don't even know that waiver's out there. So they call me, they have traditional Medicaid, but Medicaid doesn't cover those extra services like you talked about. So we make that referral over, and for anybody that doesn't know how you get waiver services, you contact your local area on aging and they start the process for you. But what I tell everyone that I send over is, don't undersell yourself. You know, a lot of the people that we're talking about have a very hard time accepting this help that they desperately need. So what I let them know, because my understanding, it is based off of your physical need. So Joel, a little bit that from my understanding, Medicaid is money driven. You know, it's eligible based on your income. So you qualify for that. Now you've got to have physical disabilities. Like, it has to be hard for you to dress yourself. You need to have help with the shower. there needs to be some physical limitations. So I try to tell everyone, I'll refer them over, and then the area on aging does their intake. Don't be shy about it. It's okay to need this help. Like, you need to be as explicit as possible with the assistance you need to show them that you need that assistance and that you'll qualify.
I got it. So that actually brought up another thing I wanted to bring up is, so when we're talking about Medicaid, there's probably a lot of people out there that are disabled or aged or just low income that need medical assistance. They kind of know that they should be looking into Medicaid. And since we're focused a lot on seniors here, we'll focus there. So that these local facilities on aging, what do you call them?
The area on aging, they're all called something different, but in each state it's the area on aging. So
how would someone find those? Like because Medicaid is a different program in every state, and they have but it seems like that in every state there is this common local area on aging, but they all have different names. How would someone find one of those in their area?
Medicaid actually has a listing of those.
So there's the actual Medicaid office, Joel, like if you're doing the traditional Medicaid, and then I didn't realize Medicaid had a list of all those agencies.
Medicaid has a list on their website. Is that?
If you have a client who has Medicaid, on the back of their card is the customer service number, right? So they can call that customer service line and ask for Division of Aging. If they do have access to the internet, they can Google Division of Aging near me, and that should populate some divisions of aging. And if they don't have the right one, they can direct them to who they need to speak to.
So if somebody's out there and they are struggling, it's a hard time, it's hard or maybe even dangerous for them to get dressed, to use the shower, to clean, to cook. We call them activities of daily living, I believe. So if somebody's having issues with those because of aging or disability, they need to call Medicaid or look up their local area on aging and see about waiver programs in their areas. That's kind of the course of action.
If they're already Medicaid qualified.
If they are Medicaid qualified.
Yeah. Correct. In order to present day, for them to be qualified for waiver, they have to have traditional Medicaid. So there are so many different plans out there, even for Medicaid. But in order to actually be qualified for waiver, they have to have traditional Medicaid. Now, next year in July, that's all going to change. But as of right now, it's traditional.
So Crystal, if anybody in our area is listening, because I know you guys don't do the actual determination. I know those go through the state and the case managers with the Department of Aging. But if there was someone out there that just didn't know, with you guys being in multiple states, would you be a resource if your information was out there and they could contact you to kind of direct them? Because there's different states have different information phone numbers. Ours is *211. But if they wanted a person to speak with, if they got someone like you, then you would steer them in the right direction. And then you would also probably end up helping out on the back end with your bridging the gap with the case managers.
Absolutely. Okay. Most definitely they can contact me. I answer a ton of those calls every day. So
it's just nice sometimes when we're Googling, and I do a lot of Googling too to find some of these places, but it would be nice to have a person and a face to direct some of our listeners to if they wanted to talk to someone one-on-one.
Absolutely. They can.
And when we release this as a podcast, we'll make sure your contact information is in our show notes so people can reach out to you.
Awesome. Thank you.
On that note, you're about to cover 41 different states. And so this puts us in an interesting position to be able to ask you, because we had a heck of a time trying to find someone that might be able to answer this question. Medicaid is a state program, and every state runs it differently. You know, there might be some states that maybe don't even have a waiver program, or there might be others that might not send out physical cards and they might cover different things. Can you just go over for a little bit the differences people might see between their states when it comes to Medicaid? Because it's hard to talk in general about Medicaid because every state might do it just a little bit differently.
Sure. So within those states, every single state has a waiver program, believe that. So it may be called something different, but they do have a waiver program. For example, Tennessee is TennCare. Kentucky is Bluegrass. So they all have their variations on what they're calling it, but it's essentially the same. And the meat and potatoes of what waiver covers within those states is pretty much the same. They tend to mirror. There are slight variations, but honestly, the bulk of it's essentially the same. So it's Medicaid itself is what is more, I think, challenging to navigate within those states. Waiver, not so much. Waiver is a fairly streamlined process, just like it is in Indiana. So there's not really too many variations, really none that pop off the top of my head at this moment. Austin, do they for you?
The one thing especially is when we're talking about different states having Medicaid, Arizona is one of the states in the United States that actually does not have Medicaid. So
No
that's
Medicaid
kind
at all?
no Medicaid.
Interesting.
Yeah, I was talking to my Aunt Shirley down there, and I said, "You guys have Medicaid? How can you afford the assisted living?" And she said to me, "Austin, I hate to tell you, down here, people just take care of themselves." And I paused for a moment.
I'm not personally licensed in Arizona, so that's not a state that I'm familiar with. Whether they do or don't, I can't confirm that. But if Austin knows, which is great, and that's why he's in the position he's in. But all the other states that I am licensed to practice in, which is great, they pretty much mirror each other.
So is there little variations with like the qualifying income limits and those kind of things in different states? Probably varies a little bit.
Now that does vary.
What it takes to qualify.
In those more poverty-stricken states, the income limit is way lower than Indiana. I believe that it was Mississippi. Correct me if I'm wrong, Austin, but I believe Mississippi's income guideline is way lower than Indiana. And I'm using Indiana just because we're here and that's home base. So
yeah.
But that's
so typically there's so much money you can make per year for a family of X amount of people. And
correct.
Usually they have like those grids at the Medicaid office or maybe even online that will show you, you can make this much money if you have a family of this many to qualify.
That's correct.
All right, so let's see if I can unravel everything that's been said and try to give like a recap. So when we're looking at Medicare is a federal program. It is to qualify for it, you have to be basically of retirement age, or you have to have been on disability for 2 years or more. And it's usually cost sharing. There are some caveats to that, but it's not usually fully covered. And so a lot of seniors get a supplement plan to cover what Medicare doesn't cover. When we get into Medicaid is a state-based insurance for people who are low income or disabled. And the Medicaid usually covers 100% of what you need it for, and usually will cover more things than Medicare. And if you are having issues with daily life, because issues with daily life isn't like an acute injury, right? You're not going to the emergency room because you have a hard time getting dressed in the morning. When you have issues with your daily life and your basic things that you need to do to live, if you're not successful, or if you're not able to do that in all reality, maybe you have friends or family or whoever coming over and helping you all the time, you may qualify through the Medicaid Waiver program to get additional help, trying to get those those activities done, whether it's helping transport you or drive you places, or helping you clean or take care of you like an in-home caregiver, that kind of thing. That is if you are on Medicaid already, and you are just to the point where you really can't take care of yourself very well. Is that kind of a good wrap up of the three? Did I hopefully demystify
I
it
would
maybe
say
a
so.
little bit? I suppose, and then the other thing to add when it comes to Medicaid is that it is your Medicaid might be called something different in every state. I think here in Connecticut we call it Husky. And the Medicaid waiver, the waiver program may be called something different in your state. And the the revenue thresholds may be different in every state to qualify for it. But when in doubt, you can contact your local Medicaid office, or you can look them up on the internet. And they can also direct you to a local area on aging. And then to take this one step further, because you can't do a synopsis about this, your local area on aging is generally like a nonprofit that helps you submit claims to Medicaid. Because when you've got, do local area on aging help with Medicare as well, or just Medicaid?
They're typically more Medicaid.
Medicaid.
Yeah.
Okay. So if you're in the Medicaid and you need to get involved in the Medicaid system to get extra support, especially regarding, not necessarily exclusively, but especially regarding the waiver, you can look up your local area on aging, or you can contact your Medicaid office to find out where they are. And they are basically nonprofits. They have different names all over the place. But they are nonprofits that help you fill out the paperwork and get what you need to get done to get the waiver program put together and finished, or get into it, apply for it. So that when you look at how daunting it can be to fill out, some of these forms and try to get them to the right people, there are nonprofits there to help, and that's what the local area on aging is. How's that? Was that
I think you
Very
got it,
good.
concise as we could be?
Yeah, and I would like to just add too, just a little bit about Crystal and Austin and what they do, because I work with case managers daily, and they're overwhelmed. They are overloaded. They have referrals sitting on their desk, and that's just what I know from home health, let alone trying to get them signed up with medical equipment and those kind of things. So I think what you guys do is amazing. These people are already qualifying for some of these extra services that we've talked about, but that case manager may not have time to get them everything that could completely do them justice. So that's where Crystal and Austin come in. And I just think it's great that you take some of that load off their back and are able to provide more individualized attention to these people that ultimately need it. So I just wanted to kind of add like a little bit of what you guys do there. You kind of pick up the slack and take a little load off of the regular everyday system.
Just a little bit of a tidbit, especially in the FSSA manual for care management in Indiana. Get this, that majority of divisions of aging are actually out of compliance, because it actually is supposed to cap out at 65 clients per care manager, where we have care managers that are 100, 125, 150, and the numbers just keep going up.
Yeah.
Wow.
And it's great that you guys are able to step in, because they are just completely overloaded. And with all the changes that keep happening, it's just going to be more work for the case managers too.
Well, I appreciate you letting us pick your brain today. So this is where we just kind of laid out, we have got the Medicare, we've got the Medicare supplement, Medicaid, the local area on aging, and then getting to the Medicaid waiver. Where in that process would somebody reach out to you for assistance? Like in between Medicaid and reaching out to the local area on aging, after reaching out to the local area on aging, when they're submitting for the Medicaid waiver, to getting Medicaid waiver services. At what point do you guys step in and kind of assist and help take some of the load off of the
So
team
all
there?
of our clients have been referred by a division of aging, and we do service the entire state of Indiana. So, all 17 of those divisions of aging, we actually have clients through. But if there is someone out there who needs assistance in navigating that system, they most definitely can reach out to us, and we can assist them through the process.
So if they're ready, if they're at a starting point, they can start with you and you'll kind of help guide them to where to go.
Sure, absolutely. We don't want anyone who is in need of services not having the ability to get those services. just because they are having a fear of the unknown. They don't really know what to do and the process involved. So, we can step in at that point and assist them with the navigation.
Okay. And so how would somebody reach out to you if they wanted some assistance? What's a good email for them?
It's Crystal at IHCSindiana.com.
All righty. Anybody else have anything to add here? I think it's been a pretty good talk. We did our best to demystify Medicare and Medicaid, although we may have to tackle this a few more times in the future to really unwind it all. But I think this was a great start. All right.
Next week we'll get into Medicare versus Medicaid or versus Medicare replacement plans a little bit more that Crystal kind of touched on. So
next week we are going to dig more into Medicare and Medicare replacement plans, the pros and cons of them, what they cover, that kind of stuff. So, all right. Well, thank you for coming out, and thank everybody for listening. And I hope you have a great week. Catch you on the next one.
Thank you guys so much. It was great having you on.
Thanks for having us.
You've been listening to the Senior Reset podcast. If you found today's episode helpful, please consider sharing with the seniors in your life so they too can live stronger, healthier, and more connected lives. Find all our episodes or submit your questions at signalhg.com/podcast. This podcast is intended for informational use and not as a replacement for medical diagnosis or care. Always consult your doctor if you have a medical issue.